Good morning, Erica. How are you?
I'm doing okay. How are you?
Great, thank you. I was just reviewing your health history form before we start today, and I noticed that you may have diabetes. Is that right?
Yeah, my doctor said that I was pre-diabetic. I have a little bit of a weight issue and my blood pressure is sometimes higher.
Okay. We did get a high blood pressure reading today, about 140/92.
Okay.
Okay.
Yeah.
Did your doctor discuss with you the implications that diabetes can have on your heart and your kidneys?
Yeah, he went into some of it, but it's a lot of information.
It is. It does increase your risk for cardiovascular disease, hypertension, and renal problems with your kidney.
Yeah.
Right.
Said some of that stuff.
Right. And since you're pre-diabetic, you could control things before it progresses into diabetes, which would be type 2 for you.
Right.
And through diet and
he said type
exercise.
2.
Okay, yeah. Through diet and exercise, you can control these things, which he should assign you a nutrition team.
Yeah, I'm supposed to follow up with him soon. I just haven't yet.
Okay, well that's good. And what else did he discuss with you regarding being
Well,
pre-diabetic?
there was a lot of information, but I don't remember some of it. Like, I've heard of diabetes before, but I really don't even, know anything about it, or if it's like a new disease or old disease. I feel like I've just heard about it more in recent years.
Right. Well, there is quite a history with diabetes. The timeline of it is referenced way back in Egyptian times. Right. But more recently, in our era, in the 1920s, there were Canadian scientists who did experiments with insulin for patients that were having sugar in their urine. And then also in the 1930s, there was a British gentleman who differentiated between type 1 and type 2 diabetes.
Okay, yeah, I think I'm type 2.
Right. And then also in the 1920s, the same Canadians that were experimenting with insulin won the Nobel Prize for their insulin experiments, and this became worldwide knowledge and really affected society in a positive way because more people were educated on diabetes and insulin.
Okay.
Right.
Fascinating.
Yeah, and then the most current information in the 1980s, they have been experimenting with synthetic insulin. So
right, okay.
that is something we use more commonly today.
Yeah.
Also,
Well, I don't think I'd have to do insulin now. I think that, if I could do something with my weight and diet, then maybe just take a pill.
Yeah, usually for treatment here in the dental setting, if we need to do anything more than just say a cleaning, we would have you take a pre-medication for your treatment. If we had to do like what's called a deep cleaning, which is a scaling and root planing, or if we had to do any sort of restorative work, which might be an implant or a filling, we might have you take a pre-antibiotic pre-med. But for a normal cleaning, we just want to make sure that your A1C and your blood glucose levels are normal.
Okay.
Do you know what those levels are today?
No. I checked my sugar a few days ago and it was a little bit high, but not my A1C.
Okay. So how long ago were you diagnosed with?
A few months ago.
Okay. And what we want to do for an A1C, and I just happen to have the measurement tool here for that. This is what an A1C would look like.
Okay, yeah.
And you want to do this about every 3 to 6 months to get an average of your blood glucose levels.
Okay, yeah.
Right?
Right.
And then we can do that for you today, so you have a baseline.
Okay.
All right? And then you do want to do regular checks with the pinprick for measuring your blood glucose, which is your
Yeah.
sugar.
I know I gotta get better with that.
Yep, it'll be about 2 to 3 times a day. And
That
then
sounds right.
Okay, and then I have this chart here for you that goes over the levels that you're looking for, if you're not familiar with that. So your A1C is down here, and then that would be 5.7 or less would be considered normal.
Okay.
And what we want to watch for if it's 6.5 to 8%.
Right.
And then also for before eating, if your blood glucose is about 70 to 130 milligrams per deciliter.
Yeah.
And then after eating, around 2 hours, you would do your blood testing again, and we're looking for about 140 or less for normal, and definitely want less than 180 milligrams if you are indeed diabetic.
Yeah, my doctor went over something like that with me, but it's a lot of numbers.
Yeah, it is. That's this little chart and pamphlet I can give you today to help you with that.
Okay, sure.
Okay. And then what we'll do today, how are you doing emotionally with the diagnosis?
Well, you know,
and-
it's a little overwhelming, but I think I'll be okay.
Okay. And do you have a support group that you see, or your nutrition team?
No, I didn't know there was anything like that.
Yeah, you should definitely have a nutrition team.
Well, I mean, the doctor mentioned nutrition team, but not a support group.
Yeah, there's some in the area, and I can give you some information regarding that.
That would be nice.
Right. Okay, yeah, I'll definitely do that for you today. And so you haven't experienced any physical limitations?
Well, you know, I'm a little out of shape, but,
Right.
you know, I'm short of breath sometimes when I'm, you know, moving around a lot. You know, and I feel like my blood pressure's high sometimes. I have some dizziness, but, you know, other than that, you know, I can do my thing.
Okay. Well, you let me know how you're doing today during treatment, because I'm going to lean you back and let me know how your breathing is doing.
Okay.
But yeah, you do have the high blood pressure, which, you know, we are concerned about, so we want to monitor that. Okay. And then also, I'm going to check for any signs or symptoms that you might be having. Have you noticed anything different with your gums?
I think for a little while now I've had a little bit of bleeding when I brush and floss, but other than that, I think everything's okay.
Okay. Yeah, we want to look for any recession, which is the gums pulling away from the teeth, if your teeth look a little bit longer to you, if there's any bleeding or swelling or redness. Also, you might notice if your disease progresses and you do become full diabetic, you might have like candidiasis, which is called thrush. Have you ever heard of that?
Is that like a yeast or something?
Yeah, it would be yeast in your mouth. So
Yeah.
sometimes diabetics are more prone to those types of infections.
Okay, yeah.
So we would want to look for that. And we just make sure to have you prepare yourself for a good home routine, good oral care. You want to brush with an electronic toothbrush very lightly and softly twice a day, and you want to do that flossing every day.
Okay.
All right? And the main thing is to maintain those blood glucose levels.
Right.
Okay. And yeah, this is a chronic condition, so you'll have to be able to maintain it throughout your whole life and make sure your blood glucose is in control, because your pancreas is no longer producing that insulin efficiently and it's not getting to your cells in the right manner. We want to make sure that you have enough energy and are healthy, you know, throughout the rest of your time.
Yeah, me too.
Okay. Do you have any other questions for me today?
I don't think so.
Okay, well, great. Let me go get the doctor, and we'll discuss what other treatment that we might be able to do today for you, depending on your glucose levels.
Okay.